Hi, I'm Brent Stafford, and this is RegWatch by regulatorwatch.com. An epidemic is spreading, but it's not the epidemic regulators, researchers, and reporters are telling the public about. It's an epidemic of fear, and the contagion comes from, well, of course, the United States. Joining us today is Dr. Brad Rodu, professor of medicine from the University of Louisville in Kentucky. Dr. Rodu, thanks for joining us today on RegWatch.
It's great to be here, Brent.
First off, you know this particular pathogen quite well. Could you explain to our viewers what's been happening in the U.S. and how it's possibly moved to Canada?
Well, certainly there's now a great fear, that vaping is taking over our adolescent or teen population. And that fear has been driven by anti-tobacco organizations that, well, let's just say it's sort of a fake epidemic. Recently, the FDA has responded to this epidemic with some rather strong words about possibly taking vape products off the market. The problem is this epidemic apparently has just arisen in 2018 because we have 2017 numbers and they don't look so serious. But now we're told, at least, that the vaping epidemic has expanded and we don't have the data, so it's a difficult problem.
Now, you're describing exactly what's been happening in Canada. Seems to be just like 3 or 4 months behind.
Exactly. You know, as you said, it's fear, and fear is very transmissible. And so I'm sure Canada is adopting the same kinds of issues that the U.S. now has.
Well, and certainly when it comes to the research, there seems to be no public access to the research that's currently purportedly being used by Health Canada to help drive potentially some of the decision making that they're going to be doing with regards to vaping.
Yes, I mean, that's been the problem all along, is that the numbers that U.S. regulators are basing their claims on simply aren't available to the wider research community. The one thing we know for sure is that in 2017, vaping was increasing, but at a modest rate. And a lot of the current frenzy about the epidemic has been based on 2018 data. And unfortunately, only the FDA, the CDC, and other federal authorities have access to that data. Now, with respect to 2017 data, one thing we know is very clear. Most teen vapers were using the products 1 to 5 days a month. So vaping was very infrequent. There was only a small percentage of teen vapers who were using the products from 20 to 30 days, which is seen as more serious use. We don't know whether those numbers have increased with the 2018 data because the CDC and FDA have only released selected information.
So they've cherry-picked their own science.
Cherry picking would be a good word for it.
For our viewers who are not familiar with who you are, give us the 30-second, synopsis of why your opinion on this matter should have weight.
Well, I've been conducting tobacco research since 1994. I've published 60 plus articles in the professional medical literature. I've established a solid approach toward helping smokers quit when they are unable or unwilling to abstain from tobacco and nicotine altogether. This involves switching them to satisfying but vastly safer smoke-free products. And for 20 years, I conducted a lot of research in smokeless tobacco, which is a completely misunderstood product as far as Americans and Canadians know. And now I've moved to vaping because I've seen the same the same strategy, the same playbook, if you will, applied to vaping as has been applied to smokeless tobacco.
Dr. Rodu, the nonprofit public health groups, the advocacy groups that seem to be so vehemently opposed to vaping, what's driving that ideology?
Well, that ideology is being driven not only by all the major medical groups, but by federal, state, provincial governments, because they see as their vision a tobacco-free society. That's a euphemism for tobacco prohibition. And so they see that as their end game. So they are completely intolerant of any safer and still satisfying forms of tobacco that could substitute for cigarette smoking.
Dr. Rodu, you just said satisfying. I want to zero in on that point for a second, because all too often it seems that opposition to vaping really is just opposition to nicotine, and opposition to nicotine is a disgust of somebody having pleasure. Is that?
Well, anti-tobacco extremists see all forms of tobacco use as a disease. Yes, smoking has been risky, but other forms of tobacco use are very low, minimal to no risk. So tobacco control has largely been driven by a medical establishment that considers smoking a disease.
And not just smoking, I would assume, then also use of, snus or any nicotine use would be considered a disease.
That's correct. Any nicotine and tobacco use is seen as a disease for which medical interventions are the only option. And tobacco harm reduction, in contrast, treats all tobacco use as a behavior. And so we encourage smokers especially to consider vastly safer and still satisfying options.
So when we're looking at what's going on then between Canada and the US and finding the similarities, we are in that similar situation where the research is just starting to come out, where apparently it's showing that there's a dramatic uptick in youth use. So worrisome. In fact, in Canada, there are numerous school principals that are actually removing bathroom doors off of the boys' bathroom in high schools, because they just simply can't trust the kids to not vape in there because they're so addicted.
We all need to be concerned about teen use of all drugs. But this new crisis of vaping has been vastly overblown.
Dr. Rodu, you mentioned that the research regarding the uptick in youth use is fake, or at least overblown, right? In Canada, we have the ink is barely dry on the regulations that legalized vaping and the devices. It was a good balance struck between regulators in the industry that provided legal access to vaping products to adults and, put in measures definitely to prevent kids. I mean, the youth use issue looms over every single aspect of the Tobacco and Vaping Products Act in Canada. So we have that situation going on. We have this research and this epidemic of fear and hysteria coming in from the United States. Do you think that this is possibly being done in order to affect regulators and to force them to force industry into making concessions, or even maybe something even more bleaker than that?
Well, there's no question that vaping is increasing among American and Canadian teens. However, the increases are being used to drive major regulatory, legislative, and legal remedies to try to kill this teen use. Keep in mind, we have to put vaping by teens in perspective with respect to alcohol use, smoking, marijuana use, and a whole host of other teen activities that we're uncomfortable with.
perspective. That doesn't sound like something that we get a whole heck of a lot out of in this issue.
No, there's no perspective. The issue's being driven by, in the American sense, it's being driven by numbers that we can't even see. The data has not been released by our federal agencies. It is based on a reported 70% increase in vaping among American teens in 2018, but we don't have access to those numbers. So we don't know if the frequency of vaping is increasing or whether it's just a natural course of teens becoming curious and interest and occasionally vaping.
Would you say it's true for Canadians to worry about what happens in the US with regard to this issue?
Well, it's hard probably for Canadians not to worry about what's going on in the US. But what I would ask Canadians to do is to take a look at the information in a rational and reasonable way, and Canadians certainly are willing to do that, and try to separate the crisis from the real facts.
How much of this crisis is just a result of, overwhelming coverage by the media that is alarming? There's no other way to, to characterize it. You have media coverage that's alarming, increasing, incessant. Then you've got, public health. Using terms like epidemic in the very first place seems to me disingenuous when it comes to using a term that describes actual real disease.
I completely agree. In fact, they're using the term epidemic here when, in fact, alcohol and marijuana use have been endemic over several decades. And one needs to ask whether vaping is more dangerous than use of alcohol and marijuana.
So what's your advice to Health Canada and researchers in Canada, that your colleagues of yours, and what's your message to them?
Well, number one, make all the data upon which you are making regulatory decisions, make that data public so we can do a full analysis of all aspects of the data. In the US, oftentimes, the data is being analyzed and then manipulated and engineered to support only one major theme. And a lot of the contagion is being driven by federal funding for research going to universities across the nation toward researchers for the sole purpose of demonstrating adverse effects of vaping. I believe that the federal funding is being funneled from tobacco companies to the FDA in the form of user fees, and from the FDA to NIH, and then NIH to universities throughout the country. And the overall focus of the research is on the adverse effects of vaping.
So let's jump into it. We're talking Tobacco 21. For all of our viewers in the US and Canada and across the world, what is it and why is it so controversial on both sides?
Well, Tobacco 21 is a movement to shift the legal purchase age of tobacco products from 18 up to 21, making it very similar to the alcohol purchase laws in the US.
And what is the problem with that for some health advocacy groups and some vaping groups?
Well, there are a lot of different issues with respect to Tobacco 21. One might be that 18 to 20-year-olds really shouldn't be treated like children. And in fact, that was one of my main concerns for a long time, that it's somewhat making our adults, young adults, children again. However, for me, one of the big problems has been the uptake of vaping in high schools. One of the things that Alcohol 21 did was remove the 18 and 19-year-olds who comprise about 14% of our high school population. They were legal purchasers of alcohol and today tobacco. If you move the age to 21, you remove the social source for a lot of these products. And you're likely to see a reduction in tobacco use like with alcohol use.
14% of all American high school students are 18-year-olds. That's a big chunk of current high school students.
Well, there's no question. And all of the national surveys show that teens' main source of tobacco products are social sources. They're not, the majority of teens are not getting tobacco products at retail. They're getting them from social sources. So when you have nationally 14% of high school students who are legal to buy tobacco products, that is a rich source for the rest of teen users. And Tobacco 21 will eliminate that source.
The opposition to Tobacco 21 on the public health side, describe that for our viewers. What is the opposition? Why is the opposition there?
Well, the opposition seems to focus around not only increased vaping among teens, but this idea that vaping is a gateway to smoking. To be fair, that has been based on a lot of exaggerated, distorted, and even engineered research.
So Dr. Rodu, you've got decades now of experience working in this area, and obviously research is your area. What percentage of the research that you could deem to be the most damning against vaping, what percentage of that research do you believe could be corrupted science?
Research is never perfect. But we have seen that the research about vaping and vaping gateway and other aspects of the teen epidemic and the teen crisis, we've seen that a lot of this research is biased, flawed, and in fact engineered to service a single concept that vaping is a public health disaster.